How to use dentist table. First, when you turn on the chair's main power, the display on the doctor table will light up as shown. The buttons for operating the chair are divided into manual mode and automatic positions. Let's start with the manual buttons. When you press and hold each manual button, the chair operates manually. Chair up, chair down, backrest down, backrest up, Next, let's look at how to save and use the automatic positions P1 and P2. To use the automatic positions, first move the chair to the preferred position manually. If you want to save the current position to P1, press and hold the P1 button until you hear a melody sound, indicating it's saved. You can save P2 in the same way. Move the chair manually to the preferred position, then press and hold the P2 button to save it as an automatic position. Next is the LP-RP function. LP is last position. This button moves the chair to the basic position after treatment. RP is return position. This button moves the chair back to the previous position before the current one. The timer can be set using the minute and second buttons, which is useful for taking impressions. First, press the minute button, and the minutes will start blinking on the screen. Use the up and down arrows to set the desired time. Likewise, press the second button, and use the arrows to set the time in seconds. The time will be saved automatically. Press the timer button to start the countdown, and a melody sound will play when the countdown ends. If you press and hold the min button, the minutes will reset. If you press and hold the sec button, the seconds will reset. Light main power. By default, the light turns on automatically when the chair is in the treatment position, and it turns off automatically when the LP button is pressed. You can also manually turn the light on or off using the power buttons on the doctor or assistant table. How to use the handpiece mode. Pick up the desired handpiece and press the wet-dry button to turn the water supply on or off. Likewise, you can use the fiber optic button to turn the optic light on or off. RPM setting mode for electric motor use. To change the RPM, first press and hold the R button. When the current gear ratio is displayed on the screen, use the arrows to select the desired gear ratio from the 3 available options. Next, use the RPM1 and RPM2 buttons to select the motor position you want to use, as shown on the screen. Depending on the motor position, pressing the corresponding button will display EL1 or EL2 on the screen. Finally, to save the set RPM, press and hold the R button until a sound is heard. In case of the improved ratio selective button model, the method of ratio selection differs from the previous model. The existing RPM3 button on the membrane is changed to gear button. Pick the desired electric motor up, press the gear button to change the desired ratio, and the final ratio is saved automatically, changing the motor's rotation direction. After selecting the motor, press the R button to change the direction. If the motor is in reverse, R will be displayed. If it's in forward, the indicator will disappear. Emergency stop function. If an unexpected situation, such as an external impact, occurs while the chair is lowering, the chair will perform an emergency stop. Pressing any manual or automatic button on the doctor table will stop the chair's operation. Settings, adjustment mode. There are 2 adjustment modes, button volume and display brightness. Adjusting button volume. Press and hold the wet-dry button, and a scale of 10 levels will appear at the bottom of the screen. You can use the arrow keys to adjust the level up or down, which allows you to control the beep sound when pressing the buttons. Adjusting display brightness. Press and hold the fiber optic button, and a scale with 5 levels will appear at the bottom of the screen. Use the arrow keys to adjust the screen brightness. After adjusting, press and hold the corresponding button until you hear a melody sound to save the settings. Changing the handpiece holder indicator LED color. When a handpiece is selected from the holder, the corresponding LED changes from blue to pink, indicating that the handpiece has been properly recognized. Handpiece water flow adjustment. There are 4 water flow adjustment valves, located on the lower right side of the doctor table. Turning the valve counterclockwise increases the water flow, while turning it clockwise decreases the flow. Scaler operation and power adjustment. The scaler can operate in 2 modes, auto and manual. First, auto mode. Step on and off the pedal once to activate the scaler. Likewise, step on and off the pedal again to stop. Second, manual mode. The scaler operates while pressing the pedal and stops when you release it. The default is auto mode. Please contact the administrator for any changes. You can adjust the scaler's power using the power adjustment valve. If the water flow is too strong, it can affect the scaler's power, so adjust the water flow accordingly for optimal performance. 3-way syringe tip attachment and detachment. To detach the scaler tip, press the front button fully and pull the tip forward to remove it. To attach the tip, press the front button all the way in and push the tip into the hole until it is securely in place. The syringe is equipped with 2 buttons, one for water and one for air. Pressing both buttons simultaneously activates the water spray function. Position of the handles on the doctor's table. The handles on the doctor's table are located on both sides of the table's front. To move the table, hold the right edge with your hand and move it back and forth. Trash cup holder. The trash cup holder allows the used cup to be reused by placing it on the mousepad holder. It can then be used for disposing of waste, such as gauze. Mount table arm locking knob. You can adjust and secure the height of the table using the knob located at the bottom of the mount balance arm. Loosening the knob counterclockwise, the table can be freely moved up and down. Tightening the knob clockwise, it can be fixed at the desired height. If you try to move the table up and down with the knob fixed, it could cause noise and damage to the knob. Please check if it's loosened. Cart table height adjustment. Similar to the mount table, you can adjust the height of the cart table by loosening the knob. Once the desired height is set, turn the knob clockwise to lock it and secure the table's height. How to lock the cart wheels. To prevent the cart from moving during treatment, push the locking lever on the wheels at the bottom of the cart downward. To move the cart, lift the locking lever upward to release the wheels. How to use the assistant table. Manual cup filling function. The manual cup button allows you to manually supply water when the automatic cup sensor is not working or when additional water is needed. Water will flow only while the button is pressed. Manual spittoon rinsing function. If manual rinsing of the spittoon is required, press and hold the button to rinse as much as needed. Automatic cup warmer function. When you press the warmer button, the cup LED changes to pink. After a 4 to 5 second preheating period, the water is supplied at a maximum temperature of 42 degrees Celsius when the cup is placed. Dental light power function. The light power can be manually controlled from the assistant table. Press the light button to turn the power on, and press it again to turn the power off. Automatic position, P1LP function. Pressing the P1 button positions the chair to P1. Likewise to the doctor table. Also pressing the LP button returns the chair to its default position. Emergency stop function. In case of an emergency during chair operation, you can use the buttons on the assistant table to perform an emergency stop. How to use the suction. In general, the chair comes with both HVE and saliva ejector. When the suction syringe is picked up from the holder, the suction motor activates, and pulling the lever down starts the suction. After the procedure, close the lever to prevent malfunctions when other chairs are in use. The saliva ejector operates in the same way. How to use the second assist suction. The second assist suction is an optional feature with a flexible hose. After positioning the suction inside the patient's mouth, open the suction lever and turn on the toggle switch located on the outside of the assistant table to start suction. When the procedure is finished, close the suction lever and make sure to turn off the toggle switch to stop the suction motor from operating. How to adjust the chair armrest. The right armrest of the chair can be rotated outward to make it easier for the patient to sit on the chair. Afterwards, push it back inward to return it to its original position. How to adjust the chair headrest. The headrest can be adjusted up or down to suit the patient's body shape and treatment position. Pressing the button on the headrest allows it to move forward or backward, enabling adjustment for maxillary or mandibular modes. Using the two joints of the headrest, it can be moved forward for a child mode or tilted backward for a wheelchair mode. Emergency safety switch function of the chair. If the chair lowers with an object, such as a foot pedal, under it after treatment, the built-in safety switch detects the collision. When a collision is detected, the chair automatically rises to protect itself from damage. How to use the foot pedal. The foot pedal is used to manually adjust the chair's position. Using the left vertical lever, pushing it to the left lowers the backrest. While pushing it to the right raises the backrest. For the right horizontal lever, lifting it upward raises the chair, and pushing it downward lowers the chair. How to use the foot pedal automatic position P1 LP buttons. Pressing the button briefly moves the chair to the P1 automatic position. Pressing and holding the button for 1 to 2 seconds moves the chair to the default position, LP. How to use the foot pedal automatic position P2 RP buttons. Similar to the P1 LP button, pressing the P2 RP button briefly moves the chair to the P2 automatic position. Pressing and holding the button for 1 to 2 seconds moves the chair to the position immediately prior to the current one. Foot pedal emergency stop function. If you need to stop the chair quickly while it's moving, press and release the foot pedal, and the chair will stop right away. Spittoon gargle mode. During treatment, the spittoon can be rotated towards the patient to make gargling easier. While the gargle mode is active, a melody will play, and an emergency icon will appear on the doctor table screen, disabling chair movement for safety. Once the patient finishes gargling, the spittoon must be returned to its original position for the chair to function normally again. Automatic cup filling with optical sensor. The automatic cup filling device uses an optical sensor to detect the cup. Once detected, water is dispensed automatically for the set time. After filling, The spittoon rinsing function activates and automatically cleans the spittoon. How to use the distilled water bottle. Before removing the distilled water bottle, set the water bottle toggle switch to the off position and ensure the air pressure drops to 0. Then, turn the bottle counterclockwise to remove it. Fill it with 1 liter of distilled water and secure it vertically by screwing it back in place. Switch the water bottle toggle to on and set the water supply to bottle. At this point, check if the pressure gauge rises to 1.5 to 2.0 bar. How to use the cup dispenser. Open the top cover of the cup dispenser and insert the paper cups. To use a cup, push the lever at the bottom with your hand, and the dispenser will release 1 cup at a time. How to use the built-in tissue box. Open the cover on top of the unit body and place the tissue box inside the designated space. Then, close the cover. The patient can take tissues one at a time through the tissue slot located on their side. How to use the surgical table. The surgical table is an optional add-on available only for the cart type. It serves as an additional table, complementing the doctor's table, and is highly functional for surgical procedures. You can adjust the height of the table by loosening or tightening the knob located on the bottom of the balance arm. How to use the dental light ML100B. To operate the light's main power from the chair. The light automatically turns on when the chair is positioned at P1 or P2 and turns off when moved to LP. Additionally, you can manually control the light by pressing the power button on either the doctor table or the assistant table to turn it on or off. Manual control of power on the light head. Separate from the chair's light power control, you can turn the light on or off by touching the power button on the light head. Function button, features of the ML100B light. Each time you press the function button on the light head, the light switches between 3 modes. Yellow-blue cut mode. White prosthetic shade matching mode. Natural mode. Light brightness, adjustment function. The brightness of the light can be adjusted using the knob on the light head. Turning the knob counterclockwise lowers the brightness, while turning it clockwise increases it. How to use the touchless motion sensor for power on-off. The light can also be turned on or off using the motion sensor located at the bottom of the light. Bring your hand close to the sensor to turn the light on, and bring it close again to turn it off. The motion sensor is generally delivered disabled, so you need to request activation through the service center. Detachable light handle. The light handle can be detached for sterilization. To remove it, press the inner button and pull the handle downward. Thank you for watching through.